Thank you all for sticking around. For those of you who don't know me, my name is Laura Wilson. I've been a Wilson all my life, so I'm pretty used to being dead last for things. Here we go. So for my practicum, I moved up to Prince George to work with the Northern Health Authority. The NHA is BC's largest authority, covering nearly 2/3 of the province, or roughly the size of France. It's also BC's least populated authority, only serving about just over 6% of BC's population. So I worked in the Population Health Division. It's made up of nine teams, most of which were kind of based out of the Centre for Healthy Living in Prince George, where I was based out of. My supervisor, the incredible Dr. Teresa Healy, was a regional manager, regional lead for healthy community development, so that's kind of where most of the scope of my work fell. So what did I do with Northern Health? My project surrounded workplace health promotion, or WHP, within Northern Health workplaces. The goal being to work with my supervisor and an advisory team, including the Director of Population Health, to find a way to both reignite past efforts and stimulate new initiatives in the realm of workplace health promotion. So the most significant of these past efforts, and kind of what we really wanted to reignite, was the My Healthy Workplace strategy that was developed in 2013-2014 through a partnership between Occupational Health and Safety and Population Health. This project outlined a strategy for implementing wellness committees throughout the authority, including a governance structure and draft terms of reference. Unfortunately, in 2014, the two executive sponsors of this initiative moved on from Northern Health, and the project had to be put on hold. So given the clear and demonstrated importance of leadership and executive support in the success of initiatives such as this, discussions at the beginning of my practicum surrounded how I could best assist in drawing leadership attention to and renewing support for WHP. It was decided that I would begin with conducting a literature review followed by a situational assessment surrounding WHP in Northern Health workplaces. This information would then be compiled to form a comprehensive package to present to upper leadership in hopes that this unified case for WHP would garner renewed attention and support. So what is workplace health promotion? According to the European Network for WHP, it is a combined effort of employers, employees, and society to improve the health and well-being of people at work. WHP utilizes a settings approach to go beyond the traditional realm of occupational health and safety, which has been primarily focused on protecting physical safety, and expanding this focus to promote the physical, mental, and spiritual well-being of all employees. So given the amount of time we spend at work and the undeniable impact that our work has on our health, the workplace is an important and often overlooked setting for health promotion. Well-designed WHP programs have been shown to result in positive impacts not only on employee health, but also on absenteeism, productivity, and job satisfaction. The importance of this is amplified in organizations such as Northern Health, who are expected to be exemplars of health and wellness, and who also suffer from relatively high rates of physical injury, stress, and caregiver burnout. Healthy healthcare workplaces are good for the employees, the patients, and the economy. So my project began with a literature review of the evidence, knowledge, and tools that had been published in the realm of WHP primarily since 2014, just to kind of refresh what had been done in the past. It was decided that the best format for this review would be an annotated bibliography, but for the sake of time, I'm not going to go into this stage other than to highlight the findings that led to and informed stage 2. So there are several models and frameworks for WHP. However, the two most widely used in North America are the Comprehensive Workplace Health Promotion Model and the CDC's Healthy Workplace Framework. Both of these stress the importance of conducting a needs or situational assessment of the organization before initiatives are planned and implemented. So this became stage 2. So the aim of the situational assessment was to create a draft document outlining Northern Health's current programs, policies, and activities in the realm of Northern Health, and to document both the facilitators and the barriers to realizing a comprehensive approach to authority-wide WHP. So an important part of this assessment was to identify and describe the various threads currently or previously occurring within the authority, including My Healthy Workplace, a 2015 leadership forum garnering leaders' perspectives on WHP, and a recent mandate from upper leadership to implement an employee smoking cessation strategy. So throughout this exploration, it became clear that a vital component of any successful WHP initiative was missing. and that was employee engagement and participation. Successful initiatives must be desired, designed, and implemented by those whom they target in order to effectively address the needs and concerns of those people in that environment and to promote ownership and uptake of programs among participants. So in order to access staff perspectives, knowledge, and experiences and to begin to engage them in this process, we decided to carry out a series of focus groups with NH employees from a variety of positions and settings. I took on the design of this study, and it was a study proposal that comprised my culminating report. So the focus group format was chosen for two primary reasons. The first being the greater depth and nuance that focus groups can garner, as opposed to surveys or other commonly used designs. And the second factor was that leadership had recently suggested that population health conduct focus groups with staff surrounding employee smoking cessation. So this provided us with a bit of an inroad to approach leadership. So a bit about the focus group methodology. In order to avoid imposing on work time, the focus groups were proposed to occur during lunchtime, with lunch served as an incentive. Given the vast geography of the authority, remote facilitation using video conference was utilized for work sites outside of the Prince George area. Recruitment into the focus groups was done utilizing a nomination strategy. This strategy was embedded in a briefing note that I had developed and sent out to leadership. So along with informing, it also served to ask leaders to nominate employees whom they thought would be good candidates for the discussions. The recommended time for a focus group is between 60 and 90 minutes, but in this workplace context with limiting union language and extremely busy participants, this just wasn't feasible. So in order to make the most of the 30 to 45-minute lunch hours, a pre-dialogue briefing email sent to all participants to inform ahead of time. Additionally, a post-dialogue quantitative survey was sent out to the participants to garner thoughts and ideas that may not have had the space or the time to be expressed in the dialogue. So again, just a recap of the overall picture, kind of the aim to make this comprehensive package to get to the upper leadership, as opposed to past efforts that had been kind of small and individual, trying to break the silos and make one big document there. So I'm going to wrap up with some of the challenges and lessons that stood out to me during this project. In terms of challenges, as I'm sure was the case for many of you, the jump from the theoretical and relatively limitless classroom arena to carrying out projects in the real world was a bit of a shocker. Unlike the relative vacuum that school projects are carried out in, there are numerous hierarchies, divisions, bargaining associations, mandates, priorities, and just so many other factors within organizations that make things not nearly so straightforward. So throughout this project, the push to be strategic was omnipresent. Every step of a process, from identifying and communicating plans and goals, to contacting key stakeholders, to requesting operational approvals, must be carefully calculated as to extract the most utility from each action in pursuit of the final goal. And working in an organization as vast and diverse as Northern Health presents challenges that may not be as significant in smaller, more localized organizations or those with a more homogeneous workforce. The wide range of employees, unions, facilities, communities, and cultures requires an extensive focus on customized community-based initiatives that, while highly valuable, are time and resource intensive and make a comprehensive, authority-wide approach to the WHP significantly more difficult. Lessons. So the importance of leadership support and securing champions. From the outset, this was a major driver of my project. Leadership support is absolutely vital to moving initiatives forward, and securing this support is a feat in its own. Identifying and securing champions at multiple levels is key to garnering this support. In our case, this was significantly aided by the leadership forum that occurred last fall. Numerous champions were identified, and these individuals played a valuable role in providing support and recruiting participants into the focus groups. The importance of participant engagement was another vital lesson. The literature and numerous case studies have shown that well-intended programs can fall flat without employee participation having been meaningfully built into each stage. In line with this settings approach, WHP programs and policies must be carefully planned and implemented, with the unique context, needs, and assets of the workplace population taken into account. This can only be achieved through understanding and valuing the true perspectives and desires of the employees themselves. And finally, as I mentioned in the previous slide, the importance of being strategic. So thank you so much to everybody that supported me through this, especially Teresa, Kelsey, and Shalane at Northern Health, and Sari, Kathy, Nigel, Betty, and Trevor for setting me up with Northern Health, and all of you, and family and friends, my mom. Yeah, so have a wonderful summer. That's it.
Hello, Laura's mom. She did a great job. Questions for Laura? I guess my snarky comment is, so because of the challenges of negotiating organizational systems, you found that your health promoting initiative was not health promoting for you?
Oh, my workplace could have been a bit healthier. Yeah, it was interesting thinking about that as I went.
Questions?
Thanks so much. That was really interesting. I know that managers have a tough time forking out more money in the healthcare industry, and I was just wondering if you could comment a little bit more on how to get buy-in from managers and departments, or if you had insight on that.
Yeah, that's kind of the biggest barrier is getting that leadership support and getting that time. So in the leadership forum, when they talked to other leaders and managers about how they felt about workplace health promotion in their workplaces and what they saw as the barriers and facilitators, a lot of them saw themselves as kind of the best tools that they had in their workplace in supporting and kind of leading their workers to be healthier at work. But they also saw the biggest barrier in finding that time and being able to rationalize that and make time for it. So it's hard. That's definitely the hardest part. But educating them on how they can make small changes. The thing about workplace health promotion is that there's so many resources and structures already in place that it's not an expensive endeavor generally. It's just finding that time and being able to rationalize that use of time. But it's tricky.
This is somewhat off topic, but I'd be curious to know if we switched our thinking to taking a degree in the School of Public Health and Social Policy as a workplace environment, if you might have any ideas as to how we could implement some of this in the online environment. No pressure.
So for the faculty or for the students? Everybody. Yeah, that's hard.
Yeah, that's pretty tough to translate it from the physical workplace to the online environment.
Yes. Yeah.
Yeah. Any other questions or comments? Nope.
I don't know if it's really a question as much as I do a lot of work with, and it actually was Shalane that I interviewed for my practicum project. But in terms of the First Nations Health Authority, we're going through a lot of changes, and I know that Northern Health is also switching from really separated primary care and health promotion and trying to integrate those two. So I think the only thing that I would mention, or your presentation kind of trips in my mind, as First Nations Health Authority starts to expand, and it actually brought me to the point where I was ready to quit. And that was because we were transitioning from being such a small authority to a large one, and we were starting to feel left out of the mix, and leadership was really making a lot of changes. And I do advocate for strong leadership, but strong leadership in terms of really advocating for their employees, and taking that perspective so that maybe our recommendations might not necessarily be carried out, but we would feel heard, I think, is probably the only thing that I would comment on. And I do really appreciate your presentation, because it's making me think about the things that we've been recommending to our leadership within the North Region. And so, yeah.
Yeah, thanks for that comment. Definitely a lot of the literature shows that, just having that strong leadership that forms those relationships and listens to their staff, and even if it isn't going to get carried out, just having that back and forth, and for staff to know that their views are heard and they are being listened to.
Well, thank you, Laura. Thank you for being last.